Hi, I'm Dr. Jen, and on today's episode, I'm going to share with you a bit more about myself and how and why I pivoted my professional work from primary care and administration to maternal mental health and motherhood. My hope is that my professional experience and the insights I've gained on my own motherhood journey will help you to better understand your own experiences and empower you to know what support you need and where to find it.
You're listening to Bloom After Baby, the podcast. We're your hosts, Rachel Daggett
And Jen Jordan.
We're a therapist
and a doctor
and both moms of two.
We're here to discuss the mental health and wellness needs that are unique to motherhood.
From confusing hormone swings to your expanding body to boundaries in tricky relationships, we'll give you the information you need to experience motherhood in a way that feels good to you. Thanks so much for tuning in. Let's get to it.
So I'll start with explaining a little bit more about my background. Before medical school, I studied medical anthropology, which looks at health and illness in the context of social, cultural, biological factors, and the relationships between those variables. So as a family medicine physician, I carried that perspective with me, and I approached patient care with that whole person perspective. Much of my clinical experience centered around women's health and mental health, depression, anxiety, some addiction medicine, also nutrition and preventative medicine were some of my focuses. And as a primary care provider, my scope of care often involved a combination of counseling and coaching, medication management, coordinating interdisciplinary care, being that kind of point person. And at the core of a treatment or care plan was always patient education, clear communication, so that as a patient, you can understand the mechanisms or physiology of what you're experiencing in a way that allows the patient to really be able to also understand what treatment or interventions are appropriate, or what they can do for prevention or health optimization. So particularly in mental health conditions, I always enjoyed helping connect the dots between mood, thoughts, with behaviors, with underlying neurochemistry, with a person's environment. This idea behind this is what's called the biopsychosocial model, or considering biological, psychological, and social factors and their complex interactions in understanding health and illness. So bringing all of this back to why I found myself pivoting my entire career trajectory clinically, when you think about the transition to motherhood, this biopsychosocial approach is so applicable, right? This transition is wholly transformative. Not only the massive physical changes you go through during pregnancy and childbirth and postpartum, but changes in lifestyle and routines, your role in your family and close relationships, your identity in friendships in your community, really your whole place in the world. And it's influenced by all those variables too. I'll introduce a term here that we'll use a lot more in future conversations, the term matrescence, which describes the developmental passage into motherhood. When hormones surge, bodies change, and identity and relationships shift. And this term, it's likened to adolescence, but obviously not as widely accepted, or at least not common knowledge in the same way that the term adolescence is. Everyone understands that adolescence is an awkward phase, and there's support and grace and understanding for adolescence. But in matrescence, there's this expectation that you just go through it, and that actually it's supposed to be a joyful and happy time, and there's not the same emphasis on that awkwardness and discomfort and pain sometimes, and how difficult this transition can be. So when I became a mom, I realized, as on the patient side of it, this isn't what we're talking about in prenatal and postpartum care. We're not informing women about what this transformation can look and feel like in a way that empowers them to prepare and anticipate their needs and make informed decisions about their health. So after experiencing it personally and seeing the other side of it, also as a medical provider, it really hit home for me that this is still such an area of need. And also that it's culturally so impactful that a mother's mental health, and especially around the birth of her child, not only essential to her well-being, but has on her children, on her partner, her other family relationships, and also related to her role in her community, maybe her professional environment. There are so many intersections and at the same time, support for women on their journey to motherhood is so fragmented and truly insufficient in some really important ways. So that's where my interests as a physician really started to shift, that I felt a calling to help close that gap. So that's a bit of an overview of my professional journey to this point, but I'll also share a bit more about my personal journey to motherhood and really where I experienced firsthand some of those gaps in care and support. Before I dive in, I do want to say that motherhood has been an honor and a blessing. And I know that discussing some of the challenges can at times sound or feel insensitive to the many people out there who desire to be parents and aren't able to do so or haven't yet. And I just want to acknowledge that there's probably not a perfect way to reconcile that, but I hope that this narrative will be able to reflect some of the real struggles that can come with the journey to motherhood in a way that is constructive and informative. So, my experience in pregnancy and postpartum from an outside perspective probably appeared to be pretty uneventful. Medically speaking, I didn't face any major challenges with either pregnancy. I did have a crash C-section, but it went smoothly after, and baby was healthy, and my physical recovery was uncomplicated. But my postpartum experience was not at all what I'd expected or had prepared for. As someone with a history of anxiety and depression, and as a physician myself, I felt I was prepared and well equipped to navigate the psychological and mood changes that I knew would come with the postpartum period. But I wasn't prepared for how some of those symptoms show up so differently in motherhood in ways I'd never felt before. The birth of my second daughter was really what brought some of these revelations to light. At the time, my younger sister was also pregnant, and our due dates were only a couple of weeks apart. And we're super close. We live near one another, so this was really exciting. We'd imagined spending most of our parental leave together, envisioning, long stroller walks, sipping lattes, hanging out with our babies together. And actually, at the time, three of my close friends were also pregnant. So we were all going through it kind of together. We were going to overlap with our postpartum periods and some of our parental leave. So not only did I have a great support system, but some of the women I was really close to were going through it at the same time. So again, the birth of my second daughter was uncomplicated. I remember being about 6 weeks postpartum. It was right around when one of my close friends was due. And I remember around then everything kind of started to shift. I had a toddler at home, and the perpetual sleep deprivation, the exhaustion was building up, and I started having a hard time finding motivation or even interest in doing things that would normally bring joy. It was hard to find motivation to meet up with friends or with my sister and her baby. And all these things that I'd looked forward to in postpartum and in my parental leave, I wasn't doing. And there was a lot of guilt for not wanting to do those things and for not savoring this time and making just the most of it, and the unmet expectations of what it should have been like carried a lot of sadness and disappointment. And I also recall around this time being swept up in massive mood swings, having some explosive anger and rage, which were new for me, intrusive thoughts, things I'd never experienced. But I didn't know how to distinguish those things, those experiences, from overwhelm and exhaustion, just new motherhood. It felt like all those things were flaws or inadequacies that I needed to just try a little harder, find a bit more balance, regulate my emotions a little bit better, and then I'd be right on track. And I didn't know how to make sense of what I was feeling. I didn't have the language to describe it. I didn't have the insight to know what was normal or even what was going on in my body, my hormone changes, the neurochemical changes that were underlying these psychological and mental shifts. And I also didn't know what support I needed, what I could do to feel better, or how to know if and when I needed to reach out for more help. So, a few months now into my second postpartum journey, I really began to recognize there were major needs I had that weren't being met by my routine healthcare. And I wasn't alone. As Rachel and I started to talk about some of these experiences we were having and have more conversations with the moms around us, we realized that all these other moms were struggling. These are sisters, best friends, coworkers, other physicians, and mental health specialists. But we weren't talking about it, at least not down to this level, because we didn't have the language. We didn't know what to even call it. We were all kind of struggling in silence. And this highlighted to us that this disconnect wasn't just about lack of good resources or access to quality care. It's that women hadn't been provided the knowledge and information that we needed to anticipate what we might feel, to make sense of these experiences. We're not given the information and tools to self identify and communicate the various ways that mood and psychological changes are manifesting in our lives, and to distinguish when those experiences or symptoms might indicate the need for additional support. And in retrospect, I can say, I think in part these deficiencies lie in the traditional approach to maternal and postpartum care that approaches mental health conditions as a matter of more screening or symptom management, as opposed to the perspective of mental wellness being about prevention and ongoing maintenance. For example, in typical prenatal care, moms are educated around how to recognize clinical depressive symptoms, maybe anxiety symptoms, but we don't talk a lot about the spectrum of feelings and symptoms that are challenging and painful, but that don't fit into clinical criteria for a mood disorder. And on top of that, how symptoms can manifest in the perinatal period. It can be so unique and tricky. For example, teasing out postpartum anxiety and intrusive thoughts from just appropriate level of worry and adjustment to learning how to take care of a baby, or fatigue and sleep deprivation from burnout or clinical depression. It's really complicated. It's such an complicated environment and period of time where so much is shifting. Also as patients, it's in typical prenatal care, we really aren't educated about the spectrum of types of perinatal mood and anxiety disorders beyond depression and anxiety. There's perinatal obsessive compulsive disorder, post traumatic stress disorder, perinatal bipolar, postpartum psychosis. And these are common. Perinatal mood and anxiety disorders, this umbrella term that encompasses these conditions, affect 1 in 5 birthing individuals. But it's estimated that about 75% of these cases go untreated because many moms have not been taught the signs and symptoms to look out for or where to go for evaluation and support. And what Rachel and I have experienced and observed is that it isn't just in pregnancy and postpartum. There are other mental health challenges that are so unique to motherhood that are ongoing well past the postpartum period. For example, the idea of invisible load or pressures of being the default parent, mom guilt, challenges that are unique to motherhood, but that there isn't a similarly unique or targeted support in the mental health and healthcare space to support that. I mean, we're finally starting to find terminology, language to even describe those conditions I just mentioned, those situations, but support and guidance is not yet built into typical care or the motherhood experience for most women. And that brings me to the last point that I'd like to talk about today, which is the challenges moms face in finding care or support options that are accessible in a way that meets them in this complicated stage of life where they have so little free time and such little flexibility. And what Rachel and I found from personal experience is that what served us the best were online tools, the resources we could turn to in the middle of the night while feeding baby or during a stroller walk. Reliable resources are out there, but it was a challenge to find them. And we felt that we were piecing together much of our own information and care plans through multiple resources online, like professionals who've gone to social media, through podcasts like this, through lots of self study. And we were starting to piece together a roadmap that started working for us. And we realized this is something we need to share. This is information that we wish we'd had when we started our journeys. So the vision became a digital support space to disseminate this information through social media, through conversations on this podcast, and through online courses and tools. We knew we could reach more moms if we could meet them where they're already at. So on their phones late at night, feeding babies, online scrolling for information the way we had. And the other piece of this vision is a community, a place that moms can feel seen and heard and be lifted up, and also the opportunity for direct one-on-one support. So that's an overview of our vision and the goals we have with Bloom After Baby. And in future episodes, we'll have the opportunity to break down some of those elements and offerings more in depth. I hope that helps explain why we're here, how we got here. And my hope is that sharing my journey will help you to better understand your own experiences and empower you to at least begin to explore other ways you need to be supported. So I will leave it at that. We're so grateful to have you here on this journey with us. And we really are in it with you. We're in the trenches. We'll share our professional expertise as best we can, and we'll also share our experiences as moms as we learn and make mistakes and learn some more. So we're here with you, and we want to hear from you. We'll have some information at the end if you're interested in coming on the podcast to join in the conversations. We'd love to hear from you. And that's all I have for today. So thank you so much for listening, for being here. We're so happy that you're here, that you found us, and there's so much more good stuff to come. So stay tuned.
Thanks so much for tuning in with us today. If you enjoyed this episode and feel like it brought you value, don't forget to rate the show and leave a review. Your feedback means the world to us and helps us know which conversations you're needing the most. And we'll keep bringing you new episodes every week, so hit subscribe so you don't miss a thing.
Also, be sure to check out the show notes for any links or resources that we mentioned. We're on this journey with you, so be sure to find us on the Gram and TikTok. Plus, go to bloomafterbaby.com and grab our free guides on all things motherhood created just for you.
Breathe, be well, and keep growing, mama.